Welcome to season 11 of the Social Work Rants podcast, providing an inside look of the social work and mental health profession, continuing to discuss social work entrepreneurship, social work being political, and the day to day aspects of the social work profession. Hope you enjoy. Hello, social workers, mental health professionals, and change agents. Welcome to season 11 of the Social Work Rants podcast. I'm your host, Bas Moreno. Saludos a todos. Greetings, everybody. Thank you for tuning in, tapping in wherever you are watching or listening to this podcast. I appreciate all the love and support. Gracias a todos por su apoyo. Continue to follow the podcast on Instagram at the Social Work Rants podcast. Subscribe to the YouTube channel. Finally hit over that 300 mark. So the drive to 400 and the 500, so I could get this monetized on this YouTube. Every coin counts, especially in this economy. So definitely, reach out, support, share episodes, comment, subscribe, download episodes. So yet, and shout out to all of you who've been listening and watching episodes continuously. So we're going to be talking about the clubhouses, the clubhouse model as it relates to mental health, and like what is it? And I've been familiar with clubhouse models. I've had clients who, in the past, who have taken clubhouse models. They're working in New York, so we're gonna. For those who don't know what that is, we're gonna be discussing that in ways uh, people living with mental illness can get involved with the clubhouse model, and even like workers, MSW students work want to do internships there, or even work at a clubhouse. Very interesting model, and someone who's trying to build one up from the ground up in New York. Richard Osoria, how you doing, my friend?
Hey, what's going on, man? Thank you for having me over here. This is really, really, really cool. I'm excited to talk about what Clubhouse is and how people can get involved for sure. So I'm happy to be here.
Nah, absolutely. No, before we get started, I do want to do a quick disclaimer. This podcast is not to be used as a substitute for individual therapy or counseling, any of that stuff. If you need help, call 988, call 911. If you have a therapist, call your therapist. If you have a psychiatrist, call your psychiatrist. It's okay not to be okay, but definitely get the help that you need. For all my out of the country listeners and who watch it on the YouTube, whatever your emergency line is, use that. Is okay not to be okay, but definitely get the help that you need. um and yes, so I like to talk about, like, networking on the podcast, the importance of networking. And we met this past March at the somos conference in New York State. My first time going, I had a blast. It was definitely meeting politicians who I follow on social media, and politicians and former uh, politicians in my former district where I live at, in borough where I live at. And like, it's like, "Hey, you represented my district." So me too.
Right, right. Yeah,
Stuff like that.
exactly.
So it was like, no, it was cool, and definitely a lot of information, and being able to present at a big conference like that. With Ponce Bank was definitely a highlight so far of my years. So halfway through the year. So and that's how we met at the conference, and one of the
Right.
mental health conferences or talks there. So just kind of the importance of networking, and we're here now recording a podcast episode.
Here we are. Yeah, for sure. Yeah. It was a great conference, by the way, for sure. Lots of, great people, lots of networking and great music too. A lot of parties.
Yeah, absolutely. Definitely the parties were definitely lit.
Mhm.
For people who don't know who you are, just tell the folks a little bit about yourself.
Sure. So my name is Rich. I've been in the healthcare field for about over 20 years. I went to Long Island University, studied art therapy, clinical art therapy. So, oftentimes people who are going through things, sometimes they don't really want to use their words to express themselves, or sometimes can't use their words to express themselves. And so they're able to do that through expressing themselves through art. And so that's something that I studied and I worked at nursing homes for about 7 years. After that, I was at one company with three adult daycare centers,
Mm.
Ridgewood, Queens, East New York, Jamaica, Queens. Sometimes I'd go to Staten Island, and I did that for about 10 years. I was the director of recreation, so I was very hands-on in programming and getting everyone involved and engaged. And then I wanted something new, and I came across something called Clubhouse. And I got to be honest, all these years in healthcare and mental health, and I've never heard of Clubhouse. And so it's an amazing model, and I'm definitely here to let more people know about what it is and what we're trying to do. Right now, our clubhouse is in the Lower East Side, Chinatown area, 48 Henry Street, New York, 10002. And we're open Monday through Fridays from 9 to 5. And how did you hear about Clubhouse, by the way?
So I'm familiar with Fountain House. I had a couple of clients which was located, well, at least at the time, it still might be there around the
Mhm.
Times Square area.
Yeah,
I had a couple of clients go there, and you mentioned Jamaica Queens. There's
Venture
a
House.
Venture House. There you go. That
Shout out to Venture House. Shout out to Fountain House and all the other clubhouses around Phoenix House. There's a lot of wonderful clubhouses in New York and all around the world. So shout out to Clubhouse International as well. We just had a conference, a seminar last month in May in Florida. And we brought two members with us, and that was really exciting. We learned a whole bunch of, things about mental health and how to operate a clubhouse and the work order day. So these are things that we'll talk about here as well.
yeah, that was my first introduction. I had clients who's going to clubhouses and visiting clients there and seeing what they do during the day. So it's definitely interesting. And I know one of the NBA WNBA reporters, Roz Gold. I always butcher her last name, but
Mhm.
I think she has her sister that goes to
Mhm.
Fountain House. So she does a lot of advocacy work regarding the clubhouses as well.
Awesome, awesome. Yeah, so here at the Lower East Side Clubhouse, we're called Elements House, and as I mentioned earlier, we're open Monday through Friday from 9 to 5. Eventually, we're going to be open Tuesday and Thursday up until 7 p.m. So we have a work order day, which is the Clubhouse model. We It's for people that are 18 and over with serious mental illness. That could be schizophrenia, schizoaffective, bipolar disorder, major depression. And while they're at the clubhouse, it's non-clinical. So when they're here, they're working alongside the staff. And what I love about Clubhouse is that there's no hierarchy. We come in here and we do things together, whether that be in the kitchen, whether that be in our communications unit, is using Canva and writing, putting together flyers, putting together newsletters, outreaching together. We have our administration unit where we focus on doing some intake, data entry, even maybe member orientations and, taking tours. And something that's exciting is right now we're putting together our podcast studio. And I would actually love
Mm,
if maybe when we get our equipment, I would love for you to come through and maybe show us a couple of things because it is brand new to us. But we're very excited. We already had our social media meeting 2 days ago to kind of like think of ideas and different things to do, and the members are really hands-on at this clubhouse over here. So we're really excited about everything that we're doing. We have a 3D printer. We have ourselves a Cricut machine. We have a poster printer. We have a shirt press, a hat press. We have all these, machines, and the goal is for our members to develop skills. Instead of
mm,
focusing on people's diagnosis, we focus on their skills and we focus on empowering and building community. I think that's what Clubhouse is about, and that's why I love the motto and I love everything that we're doing here. One thing I will mention also is our space is over 8,000 square feet. And so
mm.
people can come in and we have multiple floors. We're going to be doing construction within 3 phases. So, we're excited about that as well.
Yeah, I would love to come through once you have the equipment and kind of see and be part of something like that. That would be cool.
Yeah, yeah, for sure.
Um, how so how did you hear about it? Like, how did you get started with the clubhouse? Right.
Great question. So, just one day I was looking for something new. So I was on the internet and I was applying to several jobs. And so I got contacted by a company called NIDIS, New York Disaster Interface Services. And so, they called me and let them know that they were able to receive a contract, for the Lower East Side, for the zip code to, have a clubhouse, which is Elements House. And, I'm the assistant director. And we have Patrick, who, shout out to Patrick and Leela. Patrick is the director, and Leela is the outreach, manager coordinator. And we also have, just a great team and all our members. And, so they told us they were putting this together. The Department of Health and Mental Hygiene, they gave, three contracts for clubhouses in New York.
Mhm.
And so we're one of them, and we're in the zip code. And we're putting this together, and, we're excited because we're getting members from different boroughs from this area as well. And our goal is to just keep on pushing forward and trying to get, as many people engaged as possible, because what we notice is that, one in four people are walking around with a mental health diagnosis. And
Mhm.
I think we have sometimes not enough support. And I mean, we all know this, right? And so I think
Mhm.
like a clubhouse where they get to come and they get to work together is just really incredible. I'm happy to be a part of Elements House, and I'm happy to be a part of all the work that we're doing. And, especially networking like this and being on platforms like yours to be able to discuss what Clubhouse is.
Yeah, how can someone get on board, like a client or a consumer wants to get on board with your organization? How do you get referrals?
Sure, that's a great question. So, we always outreach to different hospitals in the area. So, Mount Sinai, Bellevue Hospital, NYC hospitals. We try to, try to connect with everyone. We table at different places like the NAMI Walk. We just did that a couple weeks ago. We
Mm,
were at the Puerto Rican Day Festival, which was, held in the
mm,
Lower East Side. Shout out to Leela because she put that together. So that was a great place, for us to, network with other people. And, we also did the Loisada Festival. And so we always try to outreach and get the word out there. As far as referrals are concerned, because of, talking to other people, they're able to refer people to us. And the way that works is we have our membership packet. They're able to fill that out. It's, simplified, so there's not too many barriers. And we have something called an attestation form. And that form, just says basically what the diagnosis is and a little bit of history about what's going on, right? And once they get that filled out by a licensed practitioner, that could be a licensed, clinical social worker, that could be a nurse practitioner, that could be a doctor, a psychiatrist. They can fill that out and they can come to our clubhouse. Now, we try to keep everything very low barrier. And also, while that process is going on, let's say they give our application, but we're still waiting on the attestation form, they're still able to come to our clubhouse and participate, and, until that attestation form is completed. But that would be the way. We do have a website where they can log on. And I guess later today, I'll leave all my information for people to be able to find me and find, our website and all our information, our membership packet, our flyers, newsletters. All that is very important for people to be able to contact us and, become a member of our Elements House, clubhouse.
Now, is there like any sort of like co competition that we know with the other clubhouses in terms of like meeting like a quota of members at they?
That's a great question. And, so the cool thing is that, we first of all we work together, we collaborate together.
Mm,
The other day we had a Tops Clubhouse, that was able to refer someone to us. Because at the end of the day, it's all about the members and their needs, right? So let's say we have someone that is maybe they just got referred to, let's say Fountain House, or they got referred to Venture House, whatever it is, whatever clubhouse it might be. But transportation might be a barrier for them. Maybe they live around this area here in Chinatown and Lower East Side. So that clubhouse might say, "Hey, you know what? Why don't you check out Element's house? They're right here, and it's maybe it's easier to get to." So I think as far as the competition is concerned, every clubhouse wants to reach certain numbers and maybe have that retention. But at the end of the day, I think it's about the member, right, and their needs. And so we do collaborate, we do get together for these conferences. And we do have something called the Clubhouse Coalition. Every Tuesday, we meet with the coalition, and it's run by Cyrus and the members. Shout out to Cyrus as well. And so what we do is in those meetings, we talk about everything Clubhouse. And so we're able to connect, we're able to collaborate, and more so work together. I think last thing I'll say, I think in the mental health field, and even with clubhouses and everything, and other organizations, we have to just break down those walls, and it's not all
Mm,
competition, it's
mm.
working together. That's the only way we're going to move forward, is working together to help people.
No, of course, yeah. This collaboration over competition, and especially in times that we are currently in, is definitely important.
Right.
Ha has your now do you call the clients? What do you call your your clients?
Great question. So we call our clients members. They're actually
Okay.
members, and it's it's a space where they come in here and the space is theirs. We also help with their resumes. We do workshops. Today we're having workshops on having mock interviews and build the members' confidence. And so that's also member led. Everything that we do is member led. The other day we had a compost workshop. You know that New York City now has a composting, and that's very important. Everyone has to do it. So we had an
What is that?
composting, great question. So anytime you cook, let's say you're in the kitchen and you're making some huevos, cooking up something, whatever it might be, some mongoose, some salami, whatever it is. Let's say eggs, for example, you have that shell. Instead of throwing it in the garbage, you're going to throw it in a compost bin. And so you're going to
Mm.
put banana peels there. You're going to put, your eggshells. You're going to put any leftover food. And so over time, what happens is it starts to become like soil. So you have
Mm.
a composting bin, you put everything in there, and it becomes soil. And you can actually take that and use it and to use it in a garden.
Oh wow.
That's what New York City is doing right now. And so there's been a lot of workshops from elected officials. You might start seeing those brown bins all over people's front yard. And that's
Mm.
basically all the composting. And New York City is going to be able to take that and reuse it, which repurpose it, which is great.
Oh, that's so interesting.
Yeah, so we're going to be having our own composting program here at the clubhouse. We have a horticulture. I didn't even finish explaining all the units we have, but we also have horticulture where we're going to be doing indoor gardening. Everything we grow, we'll be able to use it in our kitchen. We wash it, we
Mm.
chop it up, we cook it, and put it in the food. And so that's also very, really exciting. What I love about Clubhouse is that it's organic and it's dynamic. Nothing is set in stone. If we have an idea and we run with it, and someone else comes through and has another idea, we don't shut it down. We explore opportunities and say, hey, wait a minute, we're doing it this way, but let's try it this way as well and see if it works. And so that's what's exciting. We're going to have a culinary teachable kitchen, which we have already. We have members right now and staff that are making food. We have Fish Fridays today, so they're making something. I think they're making some salmon con vegetales, some vegetables. So
Oh,
that's
nice.
exciting. Yes, and so we have fun. We have fun with that.
Uh,
We also have our maintenance, site beautification, people that are into, making sure that our inventory, our supplies are, where it should be, making sure that everything is sanitized, sweeping, mopping, cleaning the bathrooms. Cleaning the bathrooms, for example, is something that staff and members do together. It's not like, oh, well, I'm the assistant director. That's not my job. No, we work together, and that's what I love is so people feel like, hey, I have someone here that could help me, which is great. One thing I'll say also is that recently we had one of our members that had a job interview. they were able to put the Clubhouse on their resume because
Mm,
all those skills that they're doing somewhere else, it's transferable. They're learning
mm.
those skills here, but they could also apply it to that, to another organization as well, which is very exciting. So that's something that we're doing here as well.
That's so cool. And that's how like for years I'm trying to integrate folks living with a mental illness in society, able to land a job, land an apartment, just doing basic ADLs to live day in day out, just like anybody else. So clubhouses are a great resource to kind of get them integrated and like I said, a job interview and transferable skills that we always talk
Right.
about in social work. So it's
Right.
no, it's very important.
Yeah, we also have our employment and education unit. So what I like is also we have on our wall, we have an employment wall, and it shows resumes. It has sample resumes. It has different roles, job roles. So it could have retail, it could have janitorial, it could be pet services, it could be human services, whatever it is. We have a resume sample, and we also have jobs that we change every week that are in the area that people can apply to if they choose to. Now, the other aspect that I love is something called transitional employment, is where the clubhouse partners up with an organization, whatever that organization might be, and we're able to train a member to work at that particular establishment. And what I love about transitional employment is that if we have a member for whatever reason, they can't make it into work for that shift, maybe they called out sick, maybe they're having a personal day, maybe they have an appointment, whatever it is, a staff member from the clubhouse has to take that shift. And so the shift will be anywhere from 9 to 5. It's going to be part-time, so maybe like 4 to 5 hours. It could be anywhere. It could be doing stock. It could be working at a laundromat. It could be working at a radio station or a concert hall, whatever it is. That's exciting. Once they finish transitional employment, let's say 6 to 9 weeks later, they can move towards something called supportive employment, where it's more focused on the member and what their goals are, what they want to do. And we help them with that as well. Wherever they're at, we always meet them where they're at and we support them all the time. We're always here to support any member for whatever it is that they need, which is very exciting. And I also mentioned education. If they want to go back to school, we can help them get started with that, whether it be getting their GED, or whether it be going to university or college. I mean, so we're very hands-on, and it doesn't have to be a staff member helping a member. It's also members helping members. It's
Mhm.
members helping staff. We all collaborate, we all work together, which is also very exciting.
Cool. What would be a benefit, say like somebody like yourself, you were looking for a job and and the clubhouse job came through, but somebody who's like newly graduated or just new into the field of social work, like what's the benefit of working in a clubhouse?
So I think the most exciting thing is that it's a different type of structure, right? It's not like your adult daycare or your nursing home or a school. The clubhouse is just like I mentioned earlier, it's very dynamic, it's very organic. Things are always changing, and it's exciting. I mean, you get an opportunity to, especially with Elements House, you get an opportunity to just build it out and leave your imprint, right? Some other clubhouses, they're already kind of established.
Mm,
And whereas in ours, we are established, but we're also, building out different sections of our clubhouse, different elements of our clubhouse. And so, we already have our kitchen up and running. We have every unit up and running, but the exciting thing is that, we're still designing the space. And so we are working with, interior decorator that comes here and speaks to our members and talks about, hey, what ideas do you have and how can we implement this at our clubhouse? And so someone graduating from a university, social work or whatever it might be, mental health professional, they can come here and just see another aspect of healthcare, mental health. Because correct me if I'm wrong, but when I was in school, there was no mention of Clubhouse. It was all nursing home. It was all,
no.
psychiatric hospitals. There was nothing of Clubhouse. And A lot of people hear Clubhouse and they think Mickey Mouse. They don't know what it
or
is.
or the app that was popular a few years ago.
Yes, yes, that too. That's another one, right? And so what's exciting is that they can come here and just see another perspective on what mental health could be. Because what I will say is that about there's a lot of bias as to people have biases, right?
Mm,
And they hear serious mental illness, and a lot of people get scared. They're like, "Whoa, wait!" And so what I like is that Clubhouse breaks down those barriers, and they say, "Yeah, just because you have a diagnosis, that does not define you, right?"
mm.
At the Clubhouse, people, they get empowered and develop those skills. They build community. They something called a term I like that one of our members use is social equity. Social equity is, connecting with other people and having people believe in you and working together and taking the relationships outside of Clubhouse, but onto the community and doing things together. The other day, Hugh Jackman, I feel that's his name. They went to go see a Broadway play, and we had one of my members that said, "Man, a year ago I would never thought I'd be here doing this. I've never been to a Broadway play before, and here we are." And so I think it's everything spilling over from inside the clubhouse to outside the clubhouse. That's the goal, is taking everything they learn in their relationships and extending that to different parts of their lives, which is really exciting.
How long have your clubhouse has been around?
We officially began and opened our doors on January 1st.
Okay.
And since then, we've been doing great. We have 30 members right now, and we continue to grow. We're continue to outreach and partner up with other organizations. We just had an organization come down right now to get a tour, and every week we look forward to just continuing this connection with other people. So it's really exciting right now.
No, that's great. Have any of your members brought up any potential concerns about everything the Trump administration is doing in terms of wanting to cut Medicaid, food stamps, Social Security, things of that nature?
For sure, yeah, we have members that have concerns, and right now we don't have anyone that's actually, I want to say, kind of directly impacted yet, but not to say that it won't be, down the line. And so we're always having those conversations about current events and what's going on and things that we can do. And what I love is that oftentimes we go to Albany. And we rally up with other clubhouses, other organizations, and we try to talk to our legislators. And so that's something I love about Clubhouse as well, is that we'll literally get a bus. Other clubhouses will get together, the coalition will set it up and say, "Hey, we're going here on this day, and this is what we're going to talk about. This is on the agenda." And so we're able to get together and really fight for what we want, for what we need.
No, that's cool. And it's so important to you know because I remember when the first Trump first time in office and working with individuals living with a mental illness, and when he cut the food stamps, that people forgot he did that, and having to explain to my clients, like, what happened to my food stamps? It got cut, and
Right,
it's like,
right,
that's federal. Don't come at me. like the
right,
government,
right,
like
right.
the government cut your food stamps. There's nothing we can do about it.
Right.
So, but
That
having
person, yeah.
to explain that to someone, is challenging in itself. So, and that stuff could potentially happen again very very quickly.
Right. That's why I think it's important for us to get together and kind of rally behind our values and what we need, what we want as a community. I think that's very important, and to educate each other also. It's not only the members are educating me because I've done art therapy and I did directed recreation, but as far as let's say getting SSI and getting housing and things of that nature, we're doing that now. Medicaid and Medicaid.
Hmm.
We're doing that together now, is applying for these things. The other day, I helped someone get Medicaid, and that's something that I personally didn't do before. But
Mm.
that's what Clubhouse is about, is getting out of your comfort zone, doing things together. And I feel like because you're doing it together, it feels a little less threatening. And I think that's what the exciting part of it is.
Yeah, absolutely. You just that's one of the good things about working in mental health, that you'll be doing so many things, and it's like you said, like doing a Medicaid application
Yes.
and housing applications, and just a variety of different things, and learning about different entitlements and other programs that exist in a city like New York, that's always trying to do different initiatives regarding anything to try to help folks, and there's a lot more resources definitely compared to where I live at, but like now, so it's definitely people got need to tap in, and like you said, that I've learned from clients as much as me teaching clients, so it's important important work that we do.
Right, right, for sure, for sure. It's I think we got to keep on pushing forward, keep on getting the word out there. Our members are outreaching with us because I think, this is a great model. It's a lot different from what we've seen.
Hmm.
And I believe that they're gonna have more clubhouses. I believe right now Long Island does not have a clubhouse. So soon enough, hopefully it will. Upstate has a Hudson Valley Clubhouse, and they're going to have a little, hopefully more clubhouses upstate as well. And just all around the world, I think it's important for people to, get exposed to this model because it's really incredible.
Mm. Cool. Where can people reach out to you?
Sure, sure. So they can definitely check us out on our website. I'll definitely send you all that information for sure. They can Google Elements House Clubhouse in the Lower East Side, and we'll come up. It's super exciting. They can also reach out to me, via email. They can do a clubhouse@nidis.org. So that's a clubhouse at nydis.org. And if they email that particular email, it'll go right to me and also my colleagues, and they'll be able to reach us, ask us any questions that you might have, and we'll definitely invite you guys for a tour. You also, man, come through, check us out. We'll feed you some lunch. We have the best food. I'm gonna tell you right now, this clubhouse has the best food. Our members are doing a great job, or the team is doing an amazing job, and I think that's what I love the most. We're also in a nice, in an amazing neighborhood, with so many opportunities. So many opportunity to check out amazing food. We have dumplings, we have Chinese spots, we have all types of restaurants. I mean, it's an incredible place, for sure to be at.
No, that's great. Best wishes. Keep up the. Oh, I did want to ask one thing. Like,
Yeah, yeah, for sure. Yeah.
one thing. I know it's a big year. It's always a big year in terms of elections. Seems like every year is a big year in terms of elections, depending where you live at. And
Right.
as of this recording, there was the second, at least the second mayoral debate that took place, and this was a big year in terms of politics for New York City mayor, and like have you gotten any like feedback regarding members like paying attention to that at all?
We always talk about current events, but most recently we have not really spoken about that at the moment. I think our focus is really here at the clubhouse, and then every member will have their own political views and who they're going to vote for. So we don't try to kind of push anyone towards to anybody, but they do look at the facts. They look to see, hey, who's going to be backing us up here? Who's going to be backing up the clubhouse? And so while we may not currently be talking about that here, they sometimes it's like open discussions amongst themselves, and they pay attention. They know what's going on. So
No, that's good. Uh, I also bring that up because I did spend like a lot of time with
Mhm.
clients in the past about trying to get them to register to vote, and you'd be surprised how very few people living with a mental illness, especially a severe mental illness, never registered to vote. So just kind of once get them stabilized, would be the importance of still get them registered to vote.
Yeah, for sure. I think that's something to look into for sure. Thank you for bringing that up because I think people definitely need to be signed up to vote so that they can get their, their voices heard.
No, absolutely.
Yeah,
Well,
for sure.
Richard, keep up the great work.
Hey man, thank you so much, and I really invite you to come out and check us out. Where are you coming from, by the way? Where are you at?
I'm in Delaware right now.
Oh, you're in Delaware. Wow, I have a good friend living in Middleton, Delaware.
Oh,
You-
that's but
Yeah.
ma- that. Oh, you gotta let me know who that is. I might know that person.
Yeah, yeah, for sure. She's a school psychologist over there, and
Oh snap! So I definitely might know that
yeah,
person.
yeah, for
Maybe
sure. Yeah, and
we'll talk offline about that.
yeah, yeah, for sure. Yeah, yeah. But hey, man, I really, really appreciate you having me on your podcast. Lots of success. And please, if you're in the New York area, anyone who's listening to this, please come check us out. Hit me up. Reach out to me, and we're here.
Cool, awesome,
Yeah. All right, man. Take care, and thank you so much.
absolutely.
Yeah.